Ankle injuries can happen to anyone at any age, but if they happen consistently, you might have a bigger problem on your hands, or should we say feet here, pun intended, obviously. In this sponsored segment, we have Dr. Nicholas Cheney, an orthopedic surgeon with OrthoNeuro, joining me to share more on ankle instability. Dr. Cheney, I'm going to say first and foremost, you probably shouldn't wear shoes like this and do anything other than sit, right?
Well, unfortunately, life doesn't work that way. So,
right.
Yes, the high heels will put you a little bit more risk of spraining the ankle. And so ankle instability is probably one of the most common things I see.
Really?
Yeah, people with chronic ankle pain. I don't know how many people have probably sprained their ankle, a dozen or so times in their lifetime, and that trauma adds up over time.
And so then is that what lateral ankle instability is, or what is it exactly?
So I like to describe it, if you think about a tire on a car, if the tire is not balanced, what happens to your tread? So the tread will wear out, right?
Yes.
So if you've got an ankle with ligaments trying to hold the bones in certain positions as it moves, if those get stretched out and allows excess motion, it can cause damage to the joint and the tendons around it.
So you alluded to the fact that people get this when they've had multiple sprains and strains, but who then does it happen to? Are people more susceptible to it?
I see it in just about everybody. Just because you're an athlete and you sprain your ankles multiple times doesn't mean that you're the patient population that experiences that. It can be anybody just with subtle tweaks here and there over time. People that run a lot, anybody that works on uneven ground, side-to-side movements, you can tweak those things. And it's like an old rubber band. It gets stretched out and eventually it doesn't function the way it was intended to.
And when you talk about athletes too, young athletes, I mean, so this can happen, we're talking about younger student athletes even up to older people, right?
Correct. I see it in all ages. I've taken care of it in, 7, 8-year-olds all the way up to 80-year-olds. And so you always want to start out with the conservative stuff first. I'll put them in a brace, some therapy, and if all that fails and it's still too uncomfortable, then we would talk about surgery at the end.
Then you would talk about that. And so when you're talking about all of these young kids and older, then how are you diagnosing it? Can somebody just heal from it, or is it going to happen?
So that's a good question. People want to say, well, can I do therapy and strengthen the ligaments? Well, unfortunately, the ligament is just a pack of collagen that connects two bones together. So the only way to tighten that would be surgically. But if we can control symptoms by retraining the muscles to work more efficiently around the ankle, they can kind of pick up the slack and hopefully become less symptomatic.
Okay, you're holding obviously a kind of example that we can show people. So where is it that are they going to be able to kind of feel where it's weak? Can they tell when they're having problems?
So it's a right ankle.
Okay.
Right? So the outside of the ankle, you've got ligaments over here that connect the ankle bone with the fibula bone, and these ligaments historically will get stretched out and the ankle will want to tilt and roll easier. And so when we treat this, we're trying to treat the muscles around the ankle to try to strengthen them to work more efficiently. And then ultimately surgery, we're tightening all those things up. Okay,
and so when you start with those more conservative options, you're talking before surgery, are people just automatically kind of rest, ice, recover? Are those kind of some of the things that they can do prior to?
Absolutely. So, the biggest key is anti-inflammatories because it's an inflammatory process that's causing the symptoms. The rest is always good. If you've got swelling, icing is good. So yeah, all those things are basics to start out with.
When you have to move to surgery, when do you decide that that's needed, and how does that process work?
So I kind of like to go through it in a stepwise fashion. So I'll put people in a brace first to give them some external support, and if it improves their symptoms, it confirms my suspicion.
Okay.
And then, typically we'll send them to physical therapy, and as long as they do well with that and their symptoms are controlled, we talk about wearing the brace long term with appropriate activities to try to maintain symptom relief. And then if patients do not respond well to that, then we start talking about going in and trying to correct the problem.
Okay, so what does that surgery look like as far as what people are going through?
So it kind of depends. I mean, you've got to look at the base that the person's standing on. Do they have a subtle high arched foot? Do they have a flat foot? You want to be able to give them a solid base to stand on first so it doesn't put your repair at risk. And then the repair is going in and basically taking the ligaments, and they're all stretched out, you cut them in half, you sew them together tighter.
Okay, it sounds so simple. What's recovery like? Are they back to normal activity?
Yeah, it's a very successful procedure. I mean, I do tons of it because there's so much of it that exists.
Yeah.
Typically it's, a couple weeks off the foot, and then we have you walking in a boot or a cast for a period of time while those ligaments scar down. And then once those ligaments have scarred down, then back to therapy to try to retain motion and strength and protect the repair.
Well, and it's great to know that there is a repair for this common problem since so many people are struggling with it. So if you think you have symptoms, obviously meet with an orthopedic surgeon, talk about your options, and get there as soon as possible, because living in pain also not the option we want people to take.
Well, the biggest issue with this is if you've got a tire that's unbalanced, the tread wears out. And so if you've got a joint that's not balanced, the risk is post-traumatic arthritis. So
Okay.
you're better with your own parts than you are with metal and plastic.
There you go. That says it all. Okay, with OrthoNeuro, there is the information to get in contact with the team on the screen. So Dr. Cheney, thank you.
Thank you.